All right. So you have somebody that comes to you and they tell you that they have a deep crawling, burning, pulling, aching, drawing, stretching sensation in their leg, keeping them up at night. It's making their spouse upset, and they're 60 years old. It's causing them to be tired during the day. So what do you want to ask them, or what do you want to do for them?
Are they iron deficient? No, you wouldn't ask that first.
So okay,
That's fair.
that's a very good
I
question.
guess you wouldn't ask them that, but what would you test them for?
Yeah.
So
For
she
example.
said iron deficient. Are they iron deficient? So good point. So why do you say that?
Because if replacement of iron is indicated, you do that in restless leg syndrome.
Yep.
If
So
they're
what's your, so let's say we're going to run a test. What are we running and what goal, level are we looking at?
check the ferritin. I don't know what the lab
Less than
parameters.
50.
Check the
Yeah,
ferritin,
50.
less than
Even if it says
50.
20, but our goal should be 50 or something.
Right, right. And what if they're not anemic and they're iron deficient? Does that matter?
Yes, it does.
Okay, how does it matter?
I mean, they are running out of their iron stores.
Right. You're
So
catching it early, right?
Yeah.
So restless leg may be an early symptom of iron deficient anemia before they're anemic. So we don't care about the CBC.
Right. And
I mean, we
yeah.
care.
We
Sorry.
care.
But
I
no, we
care.
do care. But it's a whole different. It's a whole differential, right?
Right.
It's a
Right.
completely different ball game that you want to go down and figure out why they have low iron.
Yeah.
Versus, um, if we want to jump to treatment, what would you think about for treatment?
For the
For-
low
for-
iron.
For the low iron,
Yeah, iron
but I mean,
supplementation.
and then also figuring out the cause. But what if it's you think it's restless leg? Your treatment course is a whole lot different, right? So it's very important to look for that. What other things do you want to know?
Once they come in.
Do they have a pulse?
Past medical history. Rule out the other causes which are simultaneous, which can have syndrome presentation with restless legs.
So what other things would you think about disease states that might get confused with this?
Peripheral neuropathy secondary to diabetes mellitus,
Yeah.
Parkinson's disease, uh, drugs, side effects from the drugs.
Drugs are important. Drugs are always important, right? You can never go wrong on a question, right?
It's rule number one.
It's always drugs. Always blame yourself first if it's your continuity patient and find out what they're on, or supplements and everything. So what kind of drugs could cause restless legs?
If we are
SSRIs.
supplementing with dopamine agonists, we will look for dopamine antagonists.
Yeah.
There you go.
What
So
medicine?
dopamine's
So
important.
diabetic. What medicine might they be on?
Diabetic medication. So
If it is like
Like Reglan.
Reglan, yeah, the other
Yeah.
gastropathy.
So
And
maybe because they're diabetic and we use Reglan for gastroparesis, and all of a sudden they have an irresistible urge to move their leg at night.
I like to think of any drug that causes not just restless legs, but any kind of movement problem can become restless leg, or restless leg may be mild compared to what some drugs cause. So what other kinds of drugs can cause abnormal movements as a side effect?
antipsychotics can cause.
Antipsychotics, big. And maybe we can't take them off, but it can be a big cause. So
Yeah.
antipsychotics,
TCAs,
TCAs,
antihistamines.
antihistamines.
sedating. It's only sedating antihistamines.
Yep.
That can cause, and those are easy ones to remove, right? Those are nice ones where you can cure them basically, from that. So what other big class, we use them a lot, of drugs? And again, what am I thinking? But what kind of class of drugs that a big toxicity of them is movement disorder again? Kind of related to tricyclics in some ways.
SSRIs.
Serotonin, any serotonin drug can cause that. And so again, you can actually, like, bupropion is a drug you could switch people to, and get them off, like the serotonin type drugs or the tricyclics. So
Yeah.
it's interesting. Sometimes these people come in just tired, and then they get put on a tricyclic or something, and you make their symptoms worse. So it's kind of important to take that history. So.
Absolutely.
Good.
Talk about treatment.
Yeah.
So what do you guys want to use for treatment? Do you need more history?
Um,
Yeah, I mean, as we thought about iron deficiency, if they are working in that direction to see if the cause of iron deficiency, because
Yeah. Up
figure
to
Yeah,
out.
we're
date
gonna
made
look
a
at that.
difference between intermittent and daily symptoms, and they said maybe if it's intermittent, you could consider benzo,
Hmm.
or levodopa, carbidopa. But I don't know about you, but when I've treated these people, I don't usually
Are
go
you
for
getting the
that.
nursing student?
And do you get why? What's the problem with using levodopa, carbidopa?
Oh, it
Yeah,
has its own side effects,
yeah,
long side
side
effects.
effects, end of those effects, those kind of stuff can
What are
happen.
the side effects?
It's um,
Tardive dyskinesia
oh no,
happen.
I mean it's not with
They tend to get some nausea with it.
nausea. I
So
mean
GI
that's the reason
upset,
why.
sedation, dizziness, syncope, those kind of things. Also, they're very short acting, like 90 minutes, and you can get rebound symptoms. And so I go for ropinirol
Hmm.
Mhm.
is usually what I use, and I titrate it to see how they're doing. There's a couple other ones in the family, but they have similar. The half lives are much longer, so you don't get the augmentation or like the rebound symptoms in the morning. Um, Similar side effects. And then something else that I had forgotten and seen about this is, what if you have somebody that you're convinced they have restless leg, diabetes is a risk factor, also chronic kidney disease. So those
Yeah.
two things go
Uremia, really.
hand in hand together. And same with peripheral, they have diabetic peripheral neuropathy.
Mhm.
What about gabapentin?
Say
Can
yes.
help.
Yes.
Yep.
Yeah.
Yes.
Yeah.
And so maybe they're having trouble sleeping because they have pain
Right.
in their feet from their neuropathy, and also they have some restless leg symptoms. There's been a couple of studies that with pregabalin and then the extended release form of gabapentin that shows it's at least as good as ropinirol with maybe less augmentation. Uh, Now the form
Now,
of
do you guys, can we define augmentation for people? Because I'm not sure people
Oh,
understand that.
so that means like a rebound symptom. Their symptoms actually
You're
get worse.
worse.
They'll wake up after the carbidopa levodopa wears off. They'll start waking up at 3, 4 in the morning and
They're worse
have it.
than when you started treating
Yeah,
them.
exactly. So yeah, they're worse than when you started. So
And that's not permanent. Removing the drug can take care of it, so it shouldn't keep you from trying it if that's your only option. But it's something to watch out for that happens the most with levodopa.
yeah, leave it, and they think it's just a short half life and it kind of
Yeah.
wears off and then you get rebound symptoms. So ropinirol is probably your drug of choice,
Yeah.
and I don't like using benzos that much.
I never have used a benzo for this,
Me
even though
either.
that's what you see in Up to Date and everything. And so like the biggest thing that scares me, well, besides the fact that everybody's over 80 here,
Hmm.
but if you already have sleep apnea and then you have restless leg on top of that, you or
Yeah.
COPD,
Yeah.
we can cause a lot of
And
harm.
the narcotics. I saw a
Right?
thing.
Oh yeah, I would never
If you're
use narcotics
if you're
either.
on narcotics and you take Ambien, your risk of death goes up like tenfold.
Right.
And that's Ambien. That's
Right.
a lighter form of
Right.
some of the
Benzos.
stuff. So
Well, I actually have seen some articles that suggest using narcotics for restless leg too, which that's just wrong.
yeah. So I
You
think
know, so
uh,
even peer-reviewed literature can be wrong, at least according to me.
there you go. So I think carbidopa, levodopa is out, and mostly ropinirol, and in the right circumstances, maybe gabapentin as an add-on, or even a
Yeah.
first-line therapy.
Yeah.
Now,
Um,
I don't. I want to go ahead.
do we have the extended release gabapentin here at the VI?
you
I
could.
think it's non-formulary.
It's got to
Our
be non-formulary.
pharmacist said she didn't want to be part of the video.
She's shaking her head no for not video or not formulary.
Not formulary.
But
But I think
gabapentin has a pretty long half life anyway,
Yeah.
and so I don't see. I would still
I
use
would
it.
jump into using gabapentin. I really would.
Yeah, I would use what we have here first, and then I think if you weren't successful, maybe then that would be you tried ropinirol and you tried
Sure.
the regular gabapentin, and then I'd maybe ask for Lyrica.
Yeah.
Pregabalin's been
Yeah.
studied,
Right.
but
That
I
could be
don't. I
good.
wouldn't. I would definitely not jump to it first thing.
Yeah. And I want to make one clarifying point. I don't treat. There are people that move their legs during sleep, but if they don't have sleep deprivation, I don't treat it. I don't think it's worth side effects, and I think
Yeah.
sometimes we overtreat.
But
Hmm.
what
Who's
if
their
the person
spouse?
sleeping with
Well,
them has
then
problems?
here's the deal. I am their
Along the
doctor,
middle.
not their spouse's doctor. And if it's a drug that can cause harm, I don't want to use it. Now, if it's threatening their marriage, maybe that's harm. Maybe I got to prevent that. But I might suggest